Are there any sort of side effects or problems with using Viagra and Cialis?
Every medication has some side effect. There is no free lunch. Like whatever medication you're taking, it will give you some side effect. It all depends on what's the likelihood of these side effects. So we have some absolute contraindication for these medications. People who are taking other medication like nitrates for their heart, they have a heart attack or heart problem, and they're taking these sublingual nitrates. If you do that and you take Viagra, they're going to have a massive heart attack that's going to kill them. So there's like a big red flag. Anytime you prescribe Viagra or Cialis, you have to check the other medication. You have other relative contraindication, medication that would affect blood pressure. So you have to be careful with that, because what Viagra and Cialis would do, they're going to dilate the veins, not only of the penis, but throughout your body. So this is also true for the heart. So if you dilate the vein enough and you're not getting blood supply to the coronary artery of the heart, you're risking having a heart attack. So these medication has to be prescribed in a very professional way. They have to see a provider, they have to review your medical problems, and then look at your medication that you're taking. And we have a special guideline on when to prescribe it, how much to prescribe it. So this is from a medical perspective. From a psychological perspective, a lot of younger male population taking these drug to help them with erection start to develop some dependence on it. So for a person to have an erection, you need three elements. You need a good vascular system. You need to bring blood to the penis to dilate the tissues there. You need a good nervous system. You need an impulse coming from your brain down your spinal cord to tell the penis, hey, I want an erection, I want to keep it. But then there's also the psychogenic element, which is as important as the vascular and the neurogenic. If your subconscious is not comfortable with the idea of erection, if it's not correlating erection and sex with pleasure, it's going to inhibit the whole process. Like no matter what you do, you're not going to be able to have an erection, right? So, and then this is why we have a lot of sexual therapists and sex therapy and people who would just go and dig deep into the subconscious of patients to see, is there a component of psychogenic erectile dysfunction, which most younger population have. Like younger population without diabetes or hypertension should have no reason on why they're not having a good erection. There's also what's left is this psychogenic element. Like it's either performance anxiety, they're trying to please the partner, or bad trauma from their childhood, or like bad experience. Again, something in the subconscious that's correlating sex with something that's not pleasurable. And then we have to work together to break the cycle.
Right. So in that scenario, Viagra and Cialis isn't going to be the answer?
It's part of the answer, but it's not the answer. The worst thing you can do is get these young patients, and tell them, you know what, take Viagra and then go. I'll see you in a year. This is very bad. You just have to try to understand why this is happening, where is it coming from, refer them to sex therapists, talk to them about the problem so they're aware, and then try to give them a regimen that they won't be dependent on in the future. Usually, the best thing we can do now is to give these medication as daily dose. So rather than taking Viagra or Cialis as needed, like let's say they want to have sex tonight, 2 hours before they pop the pill and they're ready, we give them a very small dose every day. So they wake up in the morning, they take this 5 milligram Cialis and they forget about it. So this way, their brain is not correlating the pill with performance. And then we give them for a couple of months, and then we start weaning them. So the next time you see them in a couple of months, you tell them, okay, rather than taking it every day, take it every other day for 4 months, twice a week, once a week. And then once you prove to your subconscious that I'm able to perform, this is pleasure, I'm happy, then you won't need anything.
It's 2025 and I have made the decision to join Function Health to help monitor and optimize my health. And honestly, after getting set up, I'm wondering what took me so long. Function makes it extremely easy to track important biometric information over a lifetime, information that you can use in real time to make important health decisions. Function gives you over 100 lab tests covering your entire body every year. Heart, hormones, liver, kidneys, thyroid, metabolic health, heavy metals, autoimmunity, nutrients, and more. 5 times more testing than your typical physical for $499 a year. A lot cheaper than if you were to order all of these tests individually. That's if you can order them. Take ApoB and LP(a), for example, 2 very important tests for determining your risk of having a heart attack or stroke. Yet, as outlined in multiple episodes on this show by Dr. Thomas Dayspring, they can be incredibly difficult to order with your local doctor. Using Function is very straightforward. You join and then visit one of their 2,000 US lab locations. I went to one here in LA where I live. It's very easy, and boom, your results are tracked over time in one secure place. No shady upselling, no gimmicks, just your results beautifully presented and science-based insights from doctors to help you optimize your health. Skip the 400,000 person waitlist today at functionhealth.com/Simon Hill and join me on the path to nerd level health optimization. That's functionhealth.com/Simon Hill. Right. Yeah, and just in case people think we've gone off on a completely different path here,
we did.
We did in some respects, but for if we're thinking about conceiving, right, being able to have and maintain an erection is going to be important. Presumably, there are men who are fertile but can't conceive because they have this erectile dysfunction.
And then closing the loop on the subject, most men coming and dealing with male infertility have some problem with erectile dysfunction because they're putting so much pressure on themselves and their subconscious that they're not providing and they're not performing. So a lot of men with bad semen parameters, when you dig deep and you ask them more, it's like, yeah, we have some problem with erection because it's more of a mechanical problem. Like for a couple to conceive naturally, it's a very, very calculated timeline. There is no randomness. There is no natural way of doing it. There is a specific time of the cycle called a fertile window. So the fertile window consists of 2 days before ovulation, the day before ovulation, the day of ovulation, and the day after. So these are 4 days during the cycle of a female.
Can you say that again? I'm
going to say it again. It's super complicated.
I'm preparing.
Okay. So a couple and a woman should track their ovulation, right? Once you know the ovulation day, they need to have intercourse 2 days before, the day before, the day of ovulation, and 1 day after. So these are 4 days of so -2, -1, day 0, which is the ovulation.
2 days before, all the way through to 1 day after.
Correct. And the idea is you need to give your sperm a head start to reach the egg before the egg is released. So the sperm has to swim from, again, the vagina to the cervix to the uterus
2
to
days?
the tube.
That's how long it can take?
And
Wow.
And the sperm can survive up to 5 days inside of a woman's reproductive system. The egg would survive 24 hours. So you want the bulk of the sperm to go there and then wait. And once the egg is released, they can attack it and then fertilize it along the way.
Okay, so if you know that ovulation day,
Correct.
and then we know that sperm life cycle is 72 days,
Correct.
but you said sometimes it might take 2 cycles, so
Correct.
let's say 6 months.
Yeah.
I mean, we're getting very granular here,
Yeah.
but let's just say 6 months out, you're improving your lifestyle, doing all these things we've spoken about. You work out ovulation day, and you're saying that you'd want to have intercourse from 2 days before ovulation day, each day, all the way through to 1 day after.
Once a day.
Once a
Correct.
day through to 1 day after.
Correct.
This may be a silly question, but leading up to the 2 days before, there's this whole idea again online of semen retention
Correct.
and no fap.
It's called an abstinence period.
Right. So what am I doing in the lead up? Am I having sex or masturbating in the week or days leading up to that? Or am I trying to build up as much volume as possible?
This is a great question. I get it every time. So to make it even more complex, so other than these 4 days, a man or individual should abstain from ejaculation, either masturbation or sex, for 3 to 4 days before that. So you have these 4 days.
3 to 4 days.
And then let's say 4 days before that, you should not ejaculate either by masturbation or sex. You should not do it for longer, because if I have patients who come in and say, you know what, we've been abstaining. We haven't done any ejaculation for the past month. Extremely bad. Because what happens is they're going to accumulate a lot of toxins and bad cells. They're going to affect negatively the sperm quality. So abstaining for a long period of time is very, very bad.
So why is there this idea online that semen retention or no FAP is like going to increase testosterone and be better?
No, just a myth.
It's a myth.
It's 100% complete myth. Again, retaining sperm has nothing to do with testosterone. Again, testosterone is just the fuel of the sperm. If you retain sperm for 3 months, your body's gonna start by killing the sperm. It's like having a vasectomy. So you're not ejaculating sperm from the testicle. What happens is your body's gonna sense an overload of sperm in the testicle, and they're gonna start killing the sperm. If you abstain for less, let's say you ejaculate the day before these 4 days, you're going to deplete the reserve. So you're not going to have enough reserve, enough sperm to swim up.
Right. So before the 4-day period where you're having intercourse every day for 4 days,
Correct.
You want to go into that with as much volume as possible.
Correct.
Which you're saying you'll achieve that with having just 3 or 4 days of abstinence.
3 or 4 days of abstinence.
Before that day one.
100%. This is the golden number. Not more, not less.
Okay.
So this is why, I'm saying all of this just to say it's a lot of pressure on the man to deliver.
Right, you really need to get the calendar out.
You have to get and this is what I tell my patient. Like, you need to go and buy a calendar. You need to have it on your fridge, and you need to mark the ovulation day for you to know that 2 days before, the day of ovulation, the day after. You need to know when to abstain and when to stop ejaculating. And if you do all of this, and you don't have any problem, and your partner doesn't have any problem, the success rate of natural conception is 15% per cycle, 1-5. And this number is set by nature. You cannot improve this number. This is why most couples are going to need a year to a year and a half to actually successfully conceive, which is, again, puts a lot of pressure, because you hear all of these stories. Like, yeah, we tried from 1 cycle, we got pregnant. We weren't even trying, we got pregnant. These are the exceptions. Most couples are just being very, very patient, doing it in a very mathematical, calculated way. When should we have it? When are these days? And this put a lot of pressure on the man to perform sexually. This is why, going back to our point, a lot of men who are dealing with fertility or trying to conceive, they feel pressure. This is not a natural way to have sex. They have to deliver during these 4 days. Like, the wife or the partner is putting a lot of pressure. Like, it's going to happen tonight.
Right, it feels,
the next 4 nights.
Very contrived.
It is.
Less spontaneous.
It is.
Less romantic.
I know.
But what you're saying is you're going to
outcomes,
increase your chances of conceiving if you take a more calculated approach.
It's not increasing it. This is the only way to naturally conceive. If you do anything other than that, this 15% goes down to almost 0.
Right. When I say increase your chance, I mean that if you're not focused on this, you may well be trying outside of this window.
But
as opposed to
the chances of you being successful and naturally conceiving are going to be almost null.
Right.
So if you're trying to conceive, this is the formula.
This is it. This is the format. Right.
If you have sex every single day of the month, but you skip these 4 days, right, it's not trying to conceive.
Okay. So just to summarize, to make sure that I've heard this right, let's pretend that the day of ovulation is the 10th of the month. Essentially, on the 4th of that month, you would abstain. That's
Correct.
when you would stop masturbating or having intercourse, any ejaculation.
Correct.
And then on the 8th of that month is when you would have intercourse. You'd have intercourse again once on the 9th, on the 10th, and on the 11th.
That's it. Success rates 15% per cycle. And these are independent probabilities. So every cycle that you're going to try, it resets to 15. It does not add up. It resets to 15. And this is why the definition of fertility was, and still is, inability to conceive over 12 months, over a year. You have to try and try and try for this process to happen.
Fertility aside, is this kind of idea of ejaculating at least once every 5 days, is that generally like a pretty good rule of thumb.
It's excellent. It's like you need to release pressure from the prostate, fluids, and you need to release sperm. So every single day, you have millions and millions of sperm being produced inside of the testicle. You need to help your body to get rid of this, because not ejaculating, retaining sperm and retaining seminal fluids and prostatic fluids are going to increase the chances of having inflammation and problem like prostatitis, orchitis, chronic pain, all sort of dysfunction in there. So this idea of let's retain is actually counterproductive from a medical perspective. Patients who come to my clinic, I'll say, you have to ejaculate an average of 2 to 3 times a week, whether masturbation or sex, any form of it. You need to release these fluid and cells to the outside body.
Yeah, I think the semen retention, no-fap kind of trend, a lot of that presumably or probably comes back to this idea that it's a masculine trait to be disciplined.
Correct.
To exhibit control.
Correct. If you can control yourself and your sexual desire, you're a better, more masculine, more virile man, which is not true.
Okay. So that's a myth busted. This episode is proudly brought to you by 38 Terra. Try 38 Terra's DMN prebiotic, the science-based daily multivitamin for your gut microbes, a simple and delicious way to take your gut health to the next level. Now back in stock in new and improved packaging for customers living in the United States, Australia, and New Zealand. Get 10% off your DMN at 38terra.com using the code THEPROOF. That's 38terra.com and use the coupon code THEPROOF for 10% off.